I'm Sam Chamberlain, and I'm a Professor of Psychiatry at the University of Southampton.
And Sam, can you give me literally like a thumbnail summary of what your project was?
Sure. So we know that lots of people out there in the community have problems with gambling addiction, which is also known as gambling disorder. Unfortunately, most people with this condition don't get the help that they need, so it's often overlooked and undertreated. So in this project, we wanted to collaborate with an independent charity called GamFam to increase support for people affected by gambling disorder. So I run a clinical service, but of course we're providing help for people affected by gambling disorder. But each person with gambling disorder has, obviously family members and loved ones who are also indirectly affected by those problems. So that was the aim of the project, really, was to address that gap, to provide more support for people which we call affected others, which is, for example, relatives and friends of people with gambling disorder.
Brilliant summary, thank you. And can you tell me, again, quite briefly if you can, how the small grant helped you for this particular project?
Certainly. So working with GamFam and the small grant we were given, we were able to set up and develop a new care pathway for people affected by gambling-related harms. So the way that works is, we had a new referral form, we changed our NHS processes so that we had a new way that people could obtain support through GamFam. So people were referred onto GamFam, and then they had peer support. And that's where, through group sessions, people can get support from people who've been through similar problems in the past in a structured way. And we've had very positive feedback from those who've been through it so far. It's just a pilot, and we're really keen to try to get some further research funding to scale up what we're doing with GamFam.
The Small Grant Showcase is a chance to try and sort of bring everybody together, link various researchers together. Can you give your reaction to that a bit? Is it useful, an event like this?
Sure. So I think this kind of event is really important because often in research and in clinical work we operate in silos. So you can have different people throughout the region interested in something like gambling disorder, but we don't know about each other. This kind of event helps to correct that, really, through providing opportunities to meet new people from different community, voluntary organisations, and also people affected by different mental health conditions as well. So it's very useful for networking and to break down barriers.